Hello, welcome back to News in Health, where we talk about different clinical cases in order for you to stay informed. This is your host, Roberta.
And your co-host Monica.
Today, we're going to talk about the clinical case of Abdiel. Abdiel is a 23-year-old university teacher that went to the clinic complaining of a dry, persistent cough and a headache. He mentioned that he has been feeling really tired and even some days he feels too tired to go to work. When he was asked about any additional symptoms, he denied diarrhea or vomiting, but he did mention eye pain. However, he isn't sure if it is because of the screen time he has after coming home in order to check assignments, emails, and messages. Adiel says he doesn't know anyone around him that is ill. However, since he is a teacher, he gives classes in lecture halls that can fill up to 100 or more students, and he does this on the weekdays.
Joining us will be Dr. Emilio Mata, a specialist in respiratory diseases, and Dr. Andrea Adame, a general practitioner with extensive experience in this medical area, and Dr. Lidia Escobar, a recent graduate and resident of the Specialized Respiratory Diseases Medical Center. These three doctors will check Abdiel's case and will give us various comments on why it caused it, how to treat it, and how to prevent it.
So, April, can you please tell us what are your symptoms?
Sure. First, I got a very persistent cough. Then I was feeling weak and tired during all day. After that, the headaches started, and I did not stop feeling chills and sweating too. And finally, I had runny nose along with a sore throat that I even didn't sleep well because of that.
Good morning, Abdul. The symptoms that you presented are part of the main symptoms of influenza. Based on the physical examination, I can say that this viral infection has been affecting you. Right now, I can see you have tired eyesight and coughing. Have you been with any ill people, hospitals, laboratories recently?
I mean, I spend a lot of time with students, but I don't think I have spent much time interacting like really close to them. And I don't think I have been with some person that is ill, sick, or something.
Okay, thank you. If you want to have an official influenza test, I, as a doctor, recommend a reverse transcription polymerase chain reaction, which is the RT-PCR, which is an exam to detect this viral infection in a more precisely way. You can do it in any laboratory.
Hello, April. Now I would like to talk about your symptoms. You explained that you have a persistent cough, some chills and sweating, as well as a runny nose, along with a sore throat. These are actually signs that your body is fighting the virus. I have seen many people go through this when their body is on the last stages before recovering from influenza.
We think that it is important to know what type of treatment will be required in order to deal with the influenza virus. That is why we wanted to ask the doctors if there is a special treatment that it is used in people that have been infected with influenza.
Well, yes, of course, there are a lot of treatments for influenza in today's medicine world, but the ones that are known for being very effective are antiviral. The flu is treated with three main antiviral drugs: oseltamivir, which is Tamiflu, zanamivir, which is Relenza, and peramivir, which is Rapivad. These drugs prevent viral particles from being released from infected host cells by interrupting the action of neuraminidase, which are enzymes on the virus surface.
We were also wondering, what kind of immune response does the body go through in these type of cases?
So the body has three primary barriers of the immune system that help fight and kill pathogens, which include physical and chemical barriers as the first line of defense, non-specific innate responses as the second, and specific adaptive responses as the third. In your case, an example would be your coughing and sneezing, which are two of the most effective ways a body tries to remove the virus. While coughing expels any kind of harmful pathogens from your body, the mucus you're experiencing traps the pathogen to later remove it with a sneeze. This also means that your body's response to influenza is an active one, because the body created the immune itself when exposed to the virus several times.
And before we get sick, is there a way to prevent getting ill?
Well, there sure is. The best way to prevent getting ill is getting vaccinated every year. Yet, avoiding contact with people that are ill, washing your hands frequently, covering your mouth when you cough, and staying at home when you're sick can help to stop the spreading of the virus.
Well, that was really interesting and helpful. Thank you very much to the doctors for giving us some of their time and making this possible. And we also thank the viewers for staying with us until the end.
Thank you very much, and remember to stay informed with us. This was News in Health.